Good morning. This is the OHSU Effect Inside Health and Science. We've got a great show for you today covering a variety of topics from treating soldiers with PTSD to even hospital room service. But first, we have an expert on health care for community-based elders, meaning people who stay in their homes as they age. Professor Mary Naylor from the University of Pennsylvania School of Nursing visiting OHSU. Good morning.
Good morning.
So you are an expert in health care for seniors. Tell us why this is a specialized field.
Well, we have a tsunami of people who are going to be entering older adult status. In fact, it has already begun. And so we've begun to appreciate that people are living longer. They're living with multiple chronic conditions, and they need something different than the current system provides.
Yes, you've developed the transitional care model. Explain what that is.
Well, this is a team-based model of care that places a premium on what older adults need, what their family caregivers needs. It relies on master's prepared nurses to work in collaboration with all of the people that are normally involved with older adults care. Their physicians, often they have multiple specialists, other nurses, physical therapists, et cetera. And it takes older adults at their most vulnerable time when they're in acute illnesses and helps to figure out how to change the way that they're experiencing care and get to better outcomes and reduce costs. So these are master's prepared nurses who begin to work with patients while they're hospitalized, follow them into their homes, and are targeting trying to get to better long-term outcomes for this population and for their families.
What are the biggest health risks for seniors?
Well, I think, in general, living to a ripe old age is for many a dream. We certainly know that we have healthier lifestyles for many of us that will allow us to live productive, healthy lives and become, even as we enter old age, really highly functional. But for others, this notion of accumulated risk gets us to a point where we have multiple chronic conditions, people waking up every day, learning what it's like to cope with different health issues and risks. They're at risk for high rehospitalizations. They're at risk for falls. They're at risk for not having the quality of life that they deserve.
How does working with the senior population compare to working with patients in a hospital setting?
Well, actually, we do work with patients in a hospital setting because that's often where we pick people up. We pick them up when they're beginning to experience our acute care system, what hospitals provide. But we know that things can go wrong in hospitals for older adults. And so a lot of the work of these nurses is in collaboration with everyone else who's touching that patient to figure out how to minimize the risk so that the seeds of bad things don't get planted. That same nurse is in the home within 24 hours, goes on the first visit to physicians so that there is a chance to really help these older adults and their family know how to capitalize on very short time these days with physicians, and then begins to work with patients and families with their goals in mind, with their goals center in care, to try to figure out how they can live a very different life than they've been enjoying over the last several months.
And it sounds like people, of course, want to stay in their homes. So is that kind of your focus?
Community focus is huge. I mean, and it doesn't mean that some people obviously won't benefit from and don't need more intensive care, but for many, given the choice, they would love to stay in their homes. They would love to stay with their neighbors and with their communities. And we have a chance for many to change it so that they can do that.
You know, there's a lot of talk about nurse and doctor shortages. Should we be worried about that?
Well, I think what we have the best opportunity to do is to think about how it is that we can reorganize the way we deliver care to better maximize on the contribution of nurses, to better maximize on their ability to work in real strong collaboration with patients, physicians, and to really also maximize on communities and the community workers. And so I think what we're about these days, because of burgeoning healthcare cost, a revolution in the way that we're going to be delivering care to older adults in the future that I think will allow us not to just be thinking about nurses, physicians as separate disciplines, but to think about teams working together with patients and families as central parts of the teams to get to better care and outcomes.
Yeah, talk a little more about that, because it sounds to me like a lot of changes need to occur in our healthcare system to prepare for this number of growing seniors.
Well, I think one of the things that absolutely needs to occur is how it is that we interact with these patients and with their families, and how it is that they begin to drive more what it is that they want and get from us as a healthcare system what it is that they need. How do we get better alignment between their needs and preferences and values, and to have a healthcare system that sees itself as supporting but not determining how health should go. So we need to better understand what people's goals are, what their values are. And I think that this is the best opportunity we have to get to a more effective and efficient healthcare system.
So is there work being done on both ends, as in training healthcare providers, training nurses, training doctors, but then also trying to keep people healthy and keep them out of the hospital in the first place?
Yes, on both ends. And I think the investment has to be on both ends. How do we create people who better know how to better self-care, to manage risks before they become chronic conditions, to better manage multiple chronic conditions? That said, they're going to come to a point in time where they need a system to be working with them and on their behalf. And so that means we need to be preparing a workforce that knows about this population, that knows about the excitement and opportunity to really affect. I was telling the story last evening at a lecture I gave about this individual. There was a story in the Washington Post that talked about our efforts, and it focused on this individual who, before we became involved in his care, was homebound for a year, not able to get out except to go into an ambulance to the hospital. And the story was how it is that what he wanted the opportunity to do was he wanted to get to Luigi's every Monday evening, and he wanted to get into his garage where he had a fabulous woodworking shop. And so did his wife. So how is it that we create an environment that allows that to happen? Because we know it can happen. And right now the care system is not as responsive as it needs to be. We need a workforce in nursing, in medicine, in social work that understand how working together towards Mr. Lynn's goals will get us a better position to address what are societal challenges in terms of rising healthcare costs.
That's quite a network that you're talking about. So, yeah. I mean, is that possible?
I think it's absolutely possible. That's what we've been demonstrating for many, many years in NIH-funded clinical trials, and then in real-life situations, working in partnership with insurers and health systems, that we can make this happen in real time today to affect those that you care about, those that I'm becoming. So we really have already demonstrated how to do it, and that it can work in real practice. And we have insurers paying for this kind of service. What we don't have is this as the national norm in healthcare delivery. Transitional care really needs to become a way that we move as a country from a very fragmented system to a very holistic, integrated one.
Well, you mentioned the lecture that you gave at the OHSU School of Nursing. Do a lot of incoming nurses have interest in this field, in this network?
It was tremendously exciting First of all, I had a chance to sit with students before I gave the lecture, and these were largely doctoral and largely doctoral students who are part of a PhD program or becoming really excellent clinicians through a DNP program. And what was tremendously exciting to me was to see the number who have decided that they are going to be making their investment in the future in this population of older adults and in the kinds of solutions that we are talking about. One came up to me and said, I want to be the next innovator. And their energy and passion really suggests to me that we are very, very lucky that the next generation is really positioning itself to take care of us.
Professor Mary Naylor, visiting from the University of Pennsylvania School of Nursing. We're glad to have you here. Thanks for coming on with us.
I'm delighted to be here. Thank you for having me.
And coming up in 5 minutes on the OHSU Effect, is there a way to detect heart disease? We'll talk to a doctor who says yes. And after that, we'll talk to a soldier who has deployed 3 times to Iraq and is treating his PTSD with meditation. We'll also meet Stephen Hyatt, the man who designs the menu up at OHSU, and he's taking some hints from 5-star hotels. This is the OHSU Effect on FM News 101 KXL.